A significant proportion of people infected with the Omicron variant of coronavirus were still contagious when they reached the U.S. Centers for Disease Control's recommended self-isolation exit date of 5 days, according to a Harvard University study of a small number of cases from the National B. Last month, the CDC shortened its recommendation for self-isolation for asymptomatic people who had tested positive for COVID from 10 days to 5 days, followed by 5 days of masking around others. The CDC's decision to not include a test-out requirement in its updated guidelines drew significant criticism, and the Harvard study adds to a small body of evidence that suggests the shortened isolation period could lead to increased transmission of the virus. Omicron-specific research is limited, but a Japanese study from last week found that 7 of 14 people with Omicron tested positive 3 to 6 days after diagnosis. A December paper from the UK Health Security Agency found that 31% of all COVID-19 cases were still infectious 5 days after the first positive test. Nathan Grubaugh, a Yale University epidemiologist and one of the study's senior co-authors, explained his primary conclusion from the findings in a Thursday tweet. Main takeaway equals ending isolation at day 5 should include a negative rapid antigen test. Otherwise isolation needs to be extended. Concerns grow over CDC's isolation guidelines. Axios 1 in 7 could still be infectious after 5-day COVID isolation. The Guardian CDC cuts recommended COVID isolation time from 10 to 5 days. Forbes.